I'd like to kind of use the remaining time to run you through the website and show you some of the features. So the website was really designed with the aim to support young people with spinal cord injuries, achieve greater healthcare independence, to support the smooth and coordinated handover from children's to adult healthcare services, and to offer young people with spinal cord injuries a way to access peer support. So to achieve this, the website includes a step-by-step guide to healthcare transition that is categorized by age and includes tools, tips, and resources to prepare the individual for the move. So the division of steps by age was informed by international and national key principles for transition and evidence-based references. So for example, GOT Transition is a federally funded national resource center in the United States that aims to improve the transition from pediatric to adult healthcare through the use of evidence in the development of strategies for healthcare providers, young people and their parents. SCI and Trapeze, as we've heard about earlier, they've published a report on the key principles for transitioning young people. And then I was also guided by this document that Jody, I believe, was trying to show before, that kind of looks at the transition phases and the age ranges and what kinds of tasks we would like to be addressing at that time. So using all of these, I went through the different age stages and thought of tips and tools for each age group. So age 12 to 14 section focuses on learning about spinal cord injury. It provides a medical summary template that users can download, save to their computer, and fill in as they learn about their injury. This provision of the medical summary aims to fulfill their recommendation for a portable and editable handover document, and it starts to build up their knowledge, the knowledge within the young person about their spinal cord injury and the health services they receive. We also start introducing tips on how to speak to healthcare professionals and what to ask them about the transition process. Aged 14 to 16 builds upon this kind of development of knowledge about the injury and services, as well as introducing a healthcare planning goal worksheet. So this worksheet aims to support young people create SMART goals, and if you work in healthcare, you've probably heard of SMART goals before, but essentially they're specific, measurable, attainable, realistic, and timely goals to achieve skills that they need to navigate the transition process. So for example, an age-appropriate skill for the goal planning sheet would be to learn about what medication they take and what they are for. At this age, we also start to introduce these concepts of privacy and confidentiality and what are your healthcare rights, and we provide links to where they can find more information on these topics. By age 16 to 17, we really wanted to start to focus more on getting transition ready. So there's a transition readiness quiz for users to complete. It asks questions like, do you know what to do in a healthcare emergency? Do you make lists of questions before you see a healthcare professional? And at the end of the quiz, it provides you with your responses, and any questions where you indicated no, it directs you to resources and tools to help change that response to a yes. So for example, if you answered no to, do you know what to do in a healthcare emergency? The website advises the user to talk to a healthcare professional or their parent or a peer support worker about what to do, and directs them to review the questions on or the tips on speaking to a healthcare professional and how and provides a link on how they can access peer support. In this section, there's also an editable transition readiness checklist for users to either complete on the computer or print out. And we draw attention to the fact that there are other normal developmental tasks going on at this, normal developmental changes going on at the same time. So the transition to higher education, relationships and sexuality concerns, and also mental health challenges. And we direct them on where they can go to find more support. Age 17 to 19 has a checklist for determining whether you're ready to transition, and if not, kind of directs you back to where you can find more information and support in the previous stages. So in addition to this kind of step-by-step guide to transition, the website aims to provide users with links to services such as inpatient, outpatient, and rehab services, community services, transition support services like ACI and GPs, but also helps to support their mental health and well-being, as this is quite a challenging time for both young people and their parents and caregivers. Young people and their parents, they also wanted more information on spinal cord injuries in the transition process. So this resource page kind of brings together all the resources from the step-by-step ages and provides links to where people can find more information. I was really aware that the website could not provide all the information that young people and their parents wanted, and that there is already a wealth of information out there on spinal cord injuries, what they are, bladder and bowel dysfunction, how to exercise with a spinal cord injury. So I felt like the best use for this website was to focus specifically on the transition period and then direct visitors onto the wonderful resources that are already available and held on the Sydney Children's Hospital Network website or the ACI Spinal Cord Injury Network websites. So that's what I've tried to do. The My Healthcare Team page introduces young people and parents to the types of healthcare professionals that they may already use or that are available. So you can click on each name and it brings up a box of information about the healthcare professional and where they can read more about them. And another recommendation from young people and their parents was to have this template in which they can match their list of contact details from their current pediatric providers with their new adult healthcare providers. So for example, which adult urologist will be taking over from their pediatric urologist. And then lastly, this peer support element, and as you've already heard from Dean, where we've got some videos highlighting top tips for transition and where people can access peer support. So there are a few things I would like to emphasize as we draw to a close. Firstly, the evaluation from young people who participated in this project indicated that being included in the co-design process was empowering, it gave them voice, and it provided them with an opportunity to be involved with something that will have actionable change in their lives. I think this really emphasizes the importance of giving young people with disabilities the opportunity to participate in research and in the development of interventions that will affect their lives. The website is live, so please go and explore it and provide your feedback on the site. The link will soon be found on the PSOS website, so you'll always know where to go to access it. Lastly, preliminary evaluation indicates young people with spinal cord injuries, parents, and healthcare professionals believe the website will support the transition from child to adult healthcare services and will equip young people with spinal cord injuries with practical and helpful tools to take charge of their healthcare. So my hope is that for the healthcare professionals listening today, you'll be able to use the website alongside your current transition process to help provide more information and guidance to the transition process. Maybe if we do this, the young people we work with won't have to make the choice between staying home with a urinary tract infection or going out on that university pub crawl. As we wrap up, I would like to invite anyone that has any questions or would like to speak to me further about the intervention to email me at the address on the screen,